Hi guys, we're at the end of week 26 of taking 150 milligrams of sertraline to treat triple PD, MDDS and CPTSD. I hope you're all doing okay. I've made a decision. I've actually reduced my dosage today. So this is the first day on 125. I'm going down slowly because that's how you need to do it. I haven't spoken to a doctor about it, but frankly, I look at the doctors and talk about it and they're like, whatever. So I've just made the decision. The reason that I've done that is because the visual symptoms are a bit too much now. There's two things that could be going on here. The first one is it's either that the medication's too high, because the audiologist said to me that I've been getting light sensitivity, blurred vision, floaters. Lance, you were talking to me about that earlier in the comments. And I just feel like I can't see clearly. And sometimes like I'm looking through like dirty glass, if you know what I mean. And I mean, I did have blurred vision before I took the meds, but not to this extent. I feel like, there's eye strain going on as well. Julie, who's somebody from Neat Arthur, the Steady Coach, is one of her recovery videos is with someone called Julie. She describes this perfectly as a symptom of having neural circuit dizziness, but it has been a lot worse since I've gone up to 150. So I've decided to come back down to 125. The psychiatrist, who is actually the one that prescribed the medication to me, it's crazy that I've seen a psychiatrist, but anyway, he said that it's one of those things with antidepressants. You have to get the right dose. Some people need more, some people need less, and it's kind of when you get to 100, you kind of know if you need to go up or down. I just went to 150 because my audiologist said that anecdotally that's what tends to work with sertraline for his patients. So I thought I'd just get up to 150 and see how I went, but actually at 125 might be okay, 100 might be okay. So I've gone back down to 125 just to see if it makes a difference on the vision. Secondly, it could be the fact that because I'm visually dominant, the vestibular physiotherapist said to me when she did a load of testing, she said, she got me to do some sort of heel to toe movements and all these kind of things with my eyes shut, and I nearly fell over. Now, normally I've got really good balance, but she said, okay, so your proprioception, like your sense of touch, and your ears aren't working with your brain along with your vision to help you balance. It's just relying on vision. So when the vision's not there, it's struggling. And, so that could also be a factor, that it's been 3 years of this now. And if that's the case, that, I'm relying on my vision to balance, then it would make sense that I would have fatigue of eye muscles. Tension in the body. This is something that Claire Weeks refers to in her books. She talks about, how people can have all these visual symptoms and like I've described, and it's to do with tension in the body interfering with the accommodation of the lens. So it can cause fatigue of eye muscles and for the eyes to be strained, and can cause blurred vision and all these kind of things. So it's one or the other. So yeah, I mean, it's a case of tweaking, like slight adjustments. I'm definitely better than I was with having had the medication. I do know that it's working. Whether an SNRI might be better for me, I don't know. Only time will tell, but I'm certainly not going to switch meds at this point. I'm just trying to get the dosage right so that the vision's a bit better, because, it's quite hard. And also there's a third factor here, in that I've started doing my creative stuff again, and I'm doing close work with jewellery. So I'm concentrating and using my eyes an awful lot. Now I am using drops in my eyes to keep them lubricated, which obviously helps them. And I'm wearing I've got reading glasses, very, very low magnifying ones. And I've also got blue tint glasses, which I wear in certain situations, but I'm not looking at screens anymore, so that's quite good. So I'm doing all those things, but yeah, it is starting to bother me. But yeah, this week's been difficult. Last night, I had a horrendous night, but it's my own fault because I've been so busy making stuff for this market this weekend. I'm forgetting to drink. This is the thing with my creative brain. So when I get on a roll with something, I just get lost in it, and that's kind of the point. I'm trying to do these things with purpose to, open up that part of my brain again and get some, it brings me joy and all these sorts of things. So I'm trying to use that as a tool towards recovery. But oh God, I forgot what I was saying. Brain fog. What was I saying? Oh, last night. So I've forgotten to drink water, and I've been drinking a lot of coffee, decaf, but a lot of coffee. And my boyfriend said to me, well, decaf's still got caffeine in it. I'm like, really? So I've probably overstimulated and not had enough water. So last night, right, I took my meds like in the evening as per usual. But as I say, not had enough water, had a busy day. It got to about 10:30 and I started to feel unwell, and I'm thinking, oh God, like what's going on here? Like panic start to set in. I tried to do some breathing, that wasn't doing anything. My whole body was trembling. And I'm lying here, I'm dog tired. I mean, so tired. And when your eyes are just closing, like you're just nodding off. And every time I closed my eyes, I felt like I was going to pass out. So it jolted me awake again. And I was like, I can't go to sleep. Not until I feel, right, what's happening? Why am I feeling like this? Is it something I've eaten? I started to feel a bit nauseous as well. And then I can't remember what the symptoms. Yeah, just the feeling like, I think they call it pre-syncope, is it? Pre-syncope is like the point before you faint, but you don't actually faint. You just feel like you're going to faint. So there's a new one on me. Hadn't had that before, but I had that last night, and I was Googling, and I shouldn't, but I was thinking, well, what is it? What is it I need to do? What could be causing it? Because I didn't know if it was something I'd eaten, or I was trying to think back to what I'd taken during the day, like supplements or whatever. And then I suddenly realised, oh my God, and it said dehydration. I thought, oh my God, yeah, I've not got enough water. So I made sure, and I've got an electrolyte tablet in my water now, so I'm getting plenty of fluids. But yeah, that's something that absolutely you need to do on antidepressants. You need to drink a lot of water. So I think there was just like this build up in my system, and I was close to passing out. So I didn't get to sleep till like 2:30, and then I had to be up early to get ready to do the market. So yeah. Anyway, I've got to remember to look after myself, put myself first. Yeah. Anyway, yeah. So I'm feeling a bit better today because I've drunk a lot, and I've had a good day at the market. I've done really well on sales. Really pleased. It was a nice day. And I was okay. I was on my own most of the day. I just got cramp in my foot. Oh, don't you just... Oh, shit. Don't you just hate cramp? It's horrible. Oh, right, sorry. I think it's gone. Oh, God. Yeah, so that's it, really. How are you guys doing? I hope you're okay. Sorry. Electrolytes in squash. I'm still waiting for the results of my MRI. Lance, let me know how you get on with the cardiologist. I still haven't seen a cardiologist because I didn't want to add any more specialists into the mix. I think, ENT, neurology, audiology and psychiatry is quite enough. Maybe I should have got my heart checked, but you know what? I went to A&E, I had an ECG, it's fine. There's nothing wrong with my heart. I did have tachycardia. I was diagnosed with POTS, like not straightforward POTS, but tachycardia. But then that went away because it was only when I had a problem walking and standing. But then I taught myself that walking and standing is safe, and now it's the sitting down that's the problem. And as soon as I did that, the tachycardia went away. Of course, you know, if you're scared of being dizzy when you stand, of course your heart rate is going to continue to increase, isn't it? Do you know what I mean? It's like, it just seemed crazy to me. And I was even saying this to the audiologist that said, oh, you've got tachycardia. When I gave him a lying, standing pulse and blood pressure results, he was like, you have got tachycardia. Maybe you should go and see a cardiologist. And I'm like, yeah, but, you know, Dr. Aaron, would it not be the case that if I have PPPD, phobic postural vertigo, whatever you want to call it, if I'm in a phobic posture, which is i.e. standing still, of course my heart rate's going to go up, right? And he was like, well, yeah, I see what you're saying, but, you know, I still think you should go to a cardiologist. But then when I got an ECG, my heart's fine. There's nothing wrong with my heart, you know? And actually, my blood pressure's good. I've been checked out. My blood pressure's good. And my pulse is good, normal. So, and it wasn't a couple of years ago. I'm telling you now, it was crazy. So that's all good. So yeah, I've just given up with doctors. I've literally given up with them. I'm just focusing. I know what I need to do. We know what we need to do. We need to be able to sit with the symptoms, accept them, as in allowing them to exist without fear, and just experience the feelings and keep practicing doing that without being afraid of them, and they will go away. Or address the underlying issue. But not everybody can identify the underlying issue, you know, because there's this belief that the symptoms are a distraction from, the symptoms are being produced by the brain for you to avoid having to deal with an emotion that's unpleasant. But not everybody can identify what that emotion is. And to be honest, from the amount of recovery videos I've seen, it's not important. I mean, the Steady Coach says it is, Dan Buglio says it isn't. And I asked the Steady Coach this, and I said, how comes you're both saying different things? She said, well, for me, finding out what the original, like what the underlying emotion is important because you don't want a recurrence of symptoms. That's why she said I encourage, you know, people to figure out what that is and to do the journaling and all that sort of inside work. But actually, you know, I know what mine is, and I think it will come with time. And I know that I've just scared the life out of myself because I've had a reaction to the vaccine that scared me, and that's what's kept me stuck. And my stress bucket was full at the time when it happened, so that's all it is, for me anyway. Something that did annoy me this week was GP again. So, right, just to anyone that hasn't seen my previous videos, I'll just quickly recap for you now. I got the AstraZeneca vaccine on the 8th of May 2021. And 4 days later, I started to have spinning vertigo. And it happened on and off over a period of 4 weeks. And on the 4th week, it was so severe that I had a panic attack with it. And that's when PPPD started. Now, it transpires from finding out later on from seeing an audiologist that there is actually a physical problem that caused it, which is BPPV, benign paroxysmal positional vertigo. He was able to establish that because he did a special test on me. He put goggles on that have a camera in them, and they're blacked out. So they're recording my movements. And when I turn my head a certain way, I can't remember how it was. I think it was when I turned my head to the left, I had an nystagmus, which means that my eyes were moving from left to right. That enabled him to see that there's a crystal that's become dislodged in my inner ear, which can be caused by inflammation or from vaccines, whatever. So that's caused a crystal to come loose into my horizontal canal, and that's what caused the spinning. Now, I haven't had spinning since, but the vaccine, if I hadn't had the vaccine, this wouldn't have happened yet. It may have happened in the future after something else, but it really wouldn't have happened. I know that. So I do not want any more vaccines. And I made it very clear. I mean, my GP surgery send me text messages, they send me emails, they send me letters. When I go in there, they're like, do you want a booster? No. You know? And there's even a text saying, you're entitled to your COVID-19 booster. Do you want it? If not, follow the link to opt out, which I've done twice. They're still calling me and still texting. And I actually went into the surgery, spoke to the practice manager and said, listen, I'm damaged from this vaccine for 3 years. I've had chronic dizziness. I do not want to hear anything else about COVID vaccines. There's no chance in a million years it will ever get me to take one again. So please, can I be removed from this list? I've asked you 3 times. This is the 3rd time. Take me off your list. Oh yeah, I'm really, really sorry, but every year the system resets itself, blah, 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 blah. I'm like, okay, but what's the point in having an opt-out link on the bloody text if you're going to keep doing it? So I opt out, and then I get a phone call yesterday, bearing in mind I'm waiting for MRI results for my breast, which I should have had every year for 20 years, a check, so it's quite a big deal for me. It's a cancer check, and I'm a cancer survivor, So I'm waiting for it. The phone rings, it's the doctors, and I'm like, okay, get ready. Hello? And they're like, oh, hello, blah, blah, blah. I can see you're entitled to your COVID-19 booster. Honestly, I lost my shit at this woman. I was like, Are you taking the piss? Sorry? I said, are you taking the piss? How many times So I lost it with them and put the phone down. I put the phone down. I'm just, honestly, done with it. Anyway, so that's my week. Next week, I'm at home for 4 days. Then I'm back. I'm in Margate now. I'm at home for 4 days, and then I'm back again on my own. So hopefully London will be kind to me this time. And I'll update you then. Hope you have a good week, guys. Hope you're okay. And if you're not, reach out. Love you lots.